Thanks all for taking time out of your day to come learn about CPR and hands-only CPR. We're going to teach and how to use an AED. I'm Alana McClellan. I work at the hospital. I've been in the emergency room. I've been worked there for 31 years in April, so it's been a while. Um, so yes, and I do a lot of education, community education, and we've done a lot of work around being a cardiac ready community, which part of that is teaching CPR to everybody because CPR is super important. This is Maya Wendell. She's a nurse at the hospital too, helping me do training. So, and Kayla is back there. She also works at the hospital. Um, and Maya's my daughter too, so she's a nurse just like her mom. So it's pretty cool. Anyway, so the reason this is so important. Oh, hey. Okay, perfect. All right. Can't say by the babies. We got to share the babies later. The reason CPR is so important is because bystanders are the first step. And without bystander CPR and knowing what to do, more people you could save a life by knowing what to do. And we want everybody to know how to do CPR. Because what CPR does is if someone's heart stops beating, which that's what cardiac arrest is, heart stops beating. So it's no longer pumping blood to like your brain, anywhere in your body. So without oxygen, you would die fast. In fact, every minute without CPR, your chance of survival goes down 10%. So think that it takes how long for an ambulance to get anywhere in town? They're pretty fast, but I mean, 10 minutes is not very long. So what CPR does is it pushes the heart, and it makes the blood go to all your important organs. So it pushes that oxygenated blood. That's why we're doing hands-only CPR now, is because the most important part is circulating the blood you have, and your blood already has some oxygen in it. So we want that to circulate. And the more compressions you do, the more it just keeps circulating, right? So you have the blood going to where it needs to go, so it can keep you alive. And then we're going to talk about AEDs. And what AEDs do is actually, that's a treatment. And it can actually, what it does is it shocks the heart so that it stops and it can return to we hope it returns to its normal rhythm. And so it can actually be a treatment and get them out of cardiac arrest. So CPR and AED is super important and anyone can do it. So I encourage you to, there's videos online for friends and family and get the word out there. You know, if you want us at the hospital to come out to your business or anywhere, we're willing to do that, to teach hands-only CPR, church, whatever. So just so you know that. So I'm going to go through the steps of what would happen. Like, imagine we have quite a few cardiac arrests in Valley City, actually, you know, and a lot of them, most of them happen out in the community, of course. And so we've had some lives saved definitely by CPR in our community. So it's a vital part of knowing how to save a life. So the first step is if someone collapses in front of you, call for help right away. Call 911 or else tell someone else. If you're by someone else, say, hey, call 911. And then, but if you're alone, you call it yourself and leave it on speakerphone because they're trained to talk you through how to do CPR too. So if you're nervous, whatever, they'll tell you what to do as well. But then they can know where to come and get the ambulance coming. So calling 911 and getting an AED is important too. So knowing where AEDs are at in town. I'm going to talk about a program we have later in town, but for now I'm just going to focus on CPR. So first step, someone collapses, call 911. And then you want to shake and tap and shout, hey, are you okay? Are you okay? And then if they don't answer, you also want to check for breathing. We don't check for a pulse anymore. If anybody's taken CPR in the past, we call 911 right away if they're not breathing. So we look, listen, and feel. So you look for chest rise, and you listen, and you can feel. That's why we put your ear down can feel it on your skin. You can listen to and look at the same time. So that's kind of how you check for breathing is, and if there's no breathing, we actually start CPR right away. And so, oh, I should back up. This is how sometimes my brain works. But making sure the scene is safe first. Like, you don't want to go into, like, if they're a down power line is why they're out. Like, make sure that it's safe to go where you're going to help a person first. But then to start CPR, it's in the center of the chest and push hard and fast is all it is. But it's actually to the beat of Staying Alive. All of you guys know Staying Alive, right? Staying Alive, Staying Alive. There's lots of other songs too, but for kids, now I've been teaching Baby Shark. If you want to sing that one's good too. Baby Shark is the rate that you need to go. So you want to be over I'm a little short. You'd have them on the ground. And you also, that's important to have them on a flat surface on the ground, not in a chair, because they're just going to sink into it, right? So getting a person safely on their back, so where they have a place to support them. And then you want to have your arms straight, hands locked like this, and go up at a rate of 100 and 120 beats per minute, but that's like staying alive. I'm not a good singer, so I don't know. But if anybody wants to sing, they can. But that's exactly how you do hands-only CPR. And so I think everybody has a mannequin to practice on, except for Jess, but I can give you her mine, so that's perfect. So now I think the best way to feel comfortable with doing it is practicing. So let's everybody practice. Yeah, go ahead. Question.
Why do we interlock?
Just because you're together in force and they stay together. And also an important part is letting it come back all the way too, because that's when it fills and can empty again. So you don't want to keep pushing really hard because you're not letting the heart fill up with blood, so you can push it out. Fill up with blood so you can push it out. So you kind of you don't want to bounce around, but make sure the chest comes all the way back up to the original position. So if you're too short for the table like I am, you want to be right over. But I think everybody can probably manage doing some chest compressions. If you want to practice, now would be a good time to do that. Yeah. All right, let's see how everybody does. So let's sing. Staying alive, staying alive, staying alive, staying alive. You gotta go a little fast.
When it comes to singing, they always ask me to sing somewhere.
So like, staying alive, staying alive. That's about right.
So we used to go like 3 fingers up from the sternum. We don't do that really necessarily
Well,
anymore.
when we teach, that's good to know for that's more of an advanced class, but we just teach kind of just in the center of the chest. You don't want to be on the xiphoid process. That's pretty far down in the abdomen. So center of the chest, kind of between the nipple line there. Depending on if you're a woman or not and old, it might not be that line, but all right. Yeah.
Let me see how you.
Sure.
Oh, no, okay, I just wanted to see where your fingers were.
Kind of the bottom here.
Yeah, so you're pressing with the palm, but you're just, yep. Staying alive, staying alive. Staying alive. Good. Or baby shark, shark.
My fingers will never make it 10 minutes.
I know, right? It's hard. It's a lot of work. Let me see how you're doing.
You'd rather have You'd be surprised if it's somebody in the revive. You'd be surprised.
Yep. You guys feel good back there? Good. All right, awesome. All right, and that's true. A good question. What's CPR stand for? Cardiopulmonary resuscitation. Yes. Right on. So let's see. I'm going to borrow an AED and this mannequin for a minute, and then we'll just I'll show you the steps to that. But yeah, it's cardiopulmonary resuscitation. I'm moving around. It's all good. An automatic external defibrillator. So a defibrillator is what shocks you, and it's external, and it just does it itself. So automated. So it's an AED. Well, you have to do both. Both. Okay, so if you have an AED right beside you, go ahead. But if you're alone, what do you think you should do if you have an AED right there on the wall? What should you do? You should go get it, because that's the treatment. So, however, if you are with me, I'd say go get the AED and I'll start CPR. You know, like the best option is to you start CPR if you have someone with you. However, if you're by yourself, go get that AED in the building if you know where it's at. You know, pay attention to where AEDs are in the community. I'm going to talk about it now because this is an important thing. The app, you want to pull it up? AED Everywhere. There's an AED Everywhere app, and we have entered yeah. So we've been working on this app store. It's called AED. Wait, let's see. Let me find it. Pulse Point. Pulse Point AED. And I have a handout on it if you want to hand out the handouts on Pulse Point. And it has it actually, you can scan it to get it on your phone. See it now, you can see there's an AED right where we're at. It shows you there's an AED here. You can click on it and it actually shows a picture of where it's at, Gockler Family Center. So we have one here. You know, so if you pull up Pulse Point, it shows that there's an AED in this building. So that's good to know, right?
Where though? This is a pretty big building.
And you know what? It does. It says second floor on pillar next to desk.
Oh, okay.
So,
Is there more than one here?
Yes, there's two.
okay. So you know what? This is a work in progress. Not every AED in town is going to be in here, because we're working on getting it up. But a lot are in here. We just haven't had some of the manpower to get it all done. It's work intensive for, you know, but we have a lot in town that's on this app. So it's a great way to know. Plus, when you call 911, they can tell you where the AEDs are. You know, they'll say, oh, you're in a building with an AED, go get it. You know, like, so all 911 dispatch knows where every AED is in town too. So that's a good thing to know. So to use an AED, there's patches. These go on the chest. The first thing you do is you turn it on. Okay, but sometimes we gotta. There we go. Well, how about let's just turn mine on for a minute. Everybody turn those off.
Next to flashing light.
Yeah, right. So it actually says what it'll tell you what to do.
Apply pad, plug-in connector.
So apply pads. So it tells you where, but it doesn't matter if you mix these up. Don't worry about it because it can go in the other spot. They're interchangeable.
Apply pad, plug-in connector.
So one pad goes up here in the shoulder, and one pad goes down here, kind of right here and here. Okay, so it. So apply pads. Then another thing is you can't put it over clothing, any medication patches, jewelry, bra,
Apply pad, insert connector.
anything like that.
If they're wet,
Yes, if they're wet, you should dry them off.
dry them off. You know,
Yeah.
like we have a pool here.
Apply pad,
Yeah.
Just
insert
wondered one day
connector firmly.
if we had to use that, how dry and, you know.
Not too dry. Just just so the pads will stick.
Just for the pad part?
Yeah, if they're in the pool, you can't do it in a body of water. You have to take them out. But if they're just
wondering
wet,
when the pool deck is wet and they're laying on the flat.
that's okay. Just
Okay.
dry them off. Yep.
Sounds good.
So then I'll just show you. So you got the pads on. It says Not all of them you have to plug in. Some of them are already attached. Depends on the kind you have. So this one,
Analyzing heart rhythm.
so it'll analyze by
Do
itself.
not touch the patient.
So you don't touch because it's analyzing, and it would feel muscle movement if you're moving it
Shock
around.
advised.
So they're going to
Charging.
shocks advised.
Stay
So
clear
charges
of the
up.
patient. Deliver shock.
And then you have to make sure no one else is touching.
Now.
To say everybody clear, all clear, shock.
Delivered.
Then you start CPR right away to pump that blood again.
CPR.
I'm going to shut this off just because it's noisy, but just keep it on because it'll go 2 more minutes and then it'll read it again. And if it needs another shock, it'll do that. So every 2 minutes, this will go off. It'll say it'll analyze the heart rhythm, which is what it's supposed to do. So it also has that tick, 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 so you can match your CPR to the beat of the AED too. So yeah, not over anything really. Some people have pacers under their skin. You can feel it looks like a big box. You wouldn't just want to put it over anything. So I'm going to show you. I got the Gockler Center kit. So AEDs almost always come with a kit. And this is the one from out in the lobby here. There's a towel to wipe people off. And then there's a scissors to cut clothes if you need to. Gloves you can use. A mask if you want to. Shaver. People with really hairy chests, it's not going to get through. It's not going to be on the skin. So I would take the time to quick shave off their chest hair. And this is, if you're doing breaths, they actually have a rescue breath with a one-way valve. You just pop it up and breathe. If you've taken a CPR class and you want to breathe, it's in there. So, and you learn more in a CPR class of how to do breaths because we still do breaths in healthcare. So these are what's in a kit. Most everyone is universal. Like this one comes with a bag, but ours doesn't at the hospital. I mean, most of them don't have a bag. Some do. So, but the rest of the stuff is pretty universal. Here, you can put that away for me. So what if it says shock not advised, continue CPR? That's okay, because what it does is not every rhythm is shockable. Sometimes people are in a non-shockable rhythm, so this wouldn't help that, but you still have to do CPR because they get a different treatment at the hospital. So sometimes it's going to say no shock advised, and that's okay. Just keep doing CPR and it'll analyze again. And also, like when you're doing CPR, you might feel cartilage, you might feel like you broke their ribs. But if you think about it, it's probably the cartilage, and there's a Good Samaritan law out there that says CPR is protected. You're not, and they're not going to live without CPR, so CPR is very important to do. So that sometimes happens, but not most of the time. We don't break ribs a lot doing CPR. It's more the cartilage that you hear and feel. So I think we should try and use an AED, but first I'll take any questions about an AED if you have one. All right. I don't have enough for everybody, so we have to share AEDs. Who doesn't? You don't have one. I'll give you one. Oh, you have one. You guys got one? I took yours. Oh, gosh. There you go. So you guys can work together and just turn it on. And go ahead and apply the pads if you need to. Oh. Oh, wait. Just take this out first because it'll make. There you go.
And then do it?
Yep. And then put it in. There you go. Here, I'll take this out first. Yep. Turn it on first. Oops. I didn't bring batteries, so that's a bad thing about it. That was this one, I think. We might have to share one.
before we do CPR?
That's the one thing I forgot was batteries for these.
We'll watch Patrick.
Oh, I got it on. I got it on.
Apply pad.
I need to remember that one needs a battery. There you go.
Pad connector.
So let's see. You could take this backing off. Put it right there.
Apply pad.
So you want
Plug
it,
in
you want
connector.
it above the heart here and below the
Right.
heart on this side.
Then you put it down here. It has pictures. I put them opposite, but it doesn't matter
okay.
which one. It doesn't matter. But
As long as
those
that
are the
one
spots.
Apply pad.
And then you put this on, plug this in.
Analyzing heart rhythm.
So don't touch
Do
it.
not
Right.
touch the patient.
Uh-huh.
Shock advised.
And it's charging.
Charging. Stay clear of patient. Deliver shock now.
So then you push that button.
Now. Shock
And then you
delivered.
start CPR right away.
Begin CPR.
Perfect. I think we got it. What do you think?
You want to do it?
No, I think I got it.
Okay.
Thing is, you have to get it so that it goes through the heart.
Yeah.
Yep. Right. Uh-huh. And then, Maya, do you want to hand out all these ones to everybody, these three? Because it has instructions on it.
It is.
No, it hasn't. I kept going to do. Oh, you are?
Oh, you guys can shut yours off. We're gonna keep rolling.
Okay. You
Good.
mean I don't have to listen to that?
That's true. I know it's a lot. Do you guys have any questions?
When it goes through the second cycle, does it tell you that?
Yeah.
If you're still doing
Yep. It'll say
impressions, like
analyzing heart rhythm. Don't touch the patient.
So then you're
Then you start back off and yep. And compressing the chest on an adult is about 2.5 inches. So pushing hard, but 2 to 2.5 inches is how far down you want to go. Okay. So now I am going to talk about pediatrics and infants.
One question.
Oh yes, go ahead.
So we would want to put one of these on before, just automatically before we try the CPR?
No,
Or is there certain instances when we actually want to use this?
if you have it available,
Yeah?
do it. But if, like, say it's you and another person,
Yeah.
well, that other person is getting the AED and even putting the patches on.
But we do want to use it if it's available. and
Yes,
do the
you do.
CPR.
The sooner you get an AED, the better the results. So, because it can shock you out of that rhythm. So yes, an AED is, if you have it, you should use it. And anybody can use it. You turn it on and it tells you what to do. That's what they've made them very easy. So everyone, and we've worked really hard. We've gotten 50 plus more AEDs in our community since we started our cardiac ready community. So we have AEDs very many places. So, and buses, yeah. I did CPR training for the school, the bus drivers.
Once in a while on some of this kind of how this feels, if you don't touch it much, I know this probably sounds different, but once in a while they'll tell you to moisten it. Do they recommend
No,
that?
uh-uh.
Not at all?
Nope. So yeah, the hair is important because if you see a video on it, sometimes they say, put the patches on, and then if it's too hairy, you can rip them off. The reason we don't teach that really is because these cost for over $100, and most facilities only have one pair. So if you rip them off, you're not going to be able to use it anymore because you've used it. So I would shave first if you think you won't, get it, because you don't want to take it off and then not have anything to use. So, and when ambulance comes, they'll take over, and but it's very important to know how to do it. So good job. Pediatrics are just are smaller. It's at least 2 inches. So if you have a small kid, sometimes you only need to use one hand to get 2 inches in. Get down far enough for a smaller pediatric kid, not the full 2 inches. It doesn't take as much for a child, but its CPR is the same for a child. It is a little different for an infant, and I am going to show you that. And we're going to practice infant choking too, because it's important to know, because infants more often it's not because of a heart problem, it's more of a respiratory problem. So but CPR on an infant is actually same place, going down about 1.5 inches, but you do use your two fingers in the middle of the chest is how you do an infant. So you guys can practice that when we give out infants too. If you come to a bigger class, they do recommend breaths for kids. Why? Because most of the time, the reason an adult is a cardiac arrest is from heart problems, right? They have a heart attack. A heart attack is not the same as a cardiac arrest. A heart attack is when there's a vessel blocked and part of your heart is not getting blood, so that part is dying. So it could cause a cardiac arrest, a heart attack. Most of the time, when a child has arrest, it's from choking or it's from a respiratory illness. That's the reason more infants. So breaths are more important for pediatric patients. I'm just going to show you how you would do breaths. I don't know if anybody who's taken a CPR class before. Okay, so I'm going to just show you a kid. You would just plug their nose just like an adult, and breathe into their mouth. So it would be 30 compressions to 2 quick breaths, because you tilt back their head, plug their nose, and breathe. Infants is you don't crank their head all the way back because they have a really soft airway and you could actually squish it. It's not a medical term, but you just want their head to be facing up. And then you actually cover their mouth and nose on an infant. It's the same, 30 and 2 breaths. But I'm just telling that for extra information. If you want to do hands-only CPR is totally appropriate till help gets there. Just if you want to know how to do breaths, you would cover their mouth and nose. So it would be, start with compressions always. 30 compressions, 2 breaths. 32 in infants and peds. So any questions about that quick? I mean, I went over that really fast, but it's the 2 fingers we recommend on infants. So choking, everybody know how to do the Heimlich maneuver? When do you do the Heimlich maneuver? When if someone cannot get any air exchange, if they're coughing and saying, I'm choking, they have some air, right? It's only if their airway is completely blocked and they're using a universal sign for choking is when you would do the Heimlich maneuver. So it's in between the navel and the breastbone here, right in the center of the chest, thrusting upward. If someone comes unresponsive during, like you're giving them the Heimlich and they pass out or they become unresponsive, do CPR. Just do compressions because it'll also force. We even say on pregnant people, you do the chest for Heimlich. You don't do the belly because you got a baby in the way. So if you have a pregnant person choking, you can just do the chest. Or our big obese where you can't really get around either. The chest is fine too because it pushes that pressure up on your airway and should. Since I've been a nurse in the ER, I've seen 4 people die from choking. So it's a real, thing. So it's important to know what to do when someone chokes too. You can do Heimlich on yourself. If you're by yourself and you're choking, you can use the back of a chair and then just kind of use it as the fist and do quick thrusts till you expel whatever you're choking on. So that works too. So questions about choking? That was really fast, but you guys are quick learners, right? All right. Do you want to hand out the babies? First, I'll show Well, I only have 4, and turn them on. So this is baby choking, and babies choke, sometimes. Yep, turn them on. These turn on even. They do. A little bit. So I'm going to show you how to do an infant choking. Okay. So it's 5 back thrusts and 5 chest thrusts. So you always want to support a neck on a baby, right? Say this baby's choking. Oh no. And doesn't get any air exchange. Okay. So you hold the neck, and sitting is the best way to do it because you have support of your legs. So you hold their head and you put them down like this, and you do back thrusts pretty hard. Okay, 1, 2, 3, 4, 5, and then you flip it over and do chest thrusts like you would do CPR. This is the same thing you do for CPR. 3, 4, 5. Then you flip it and you do. I saved the baby! Yay! That's why I wanted to turn them on, because you could save your baby. So I want everybody to try, whoever wants to try choking on an infant. Here you go. Okay, so baby's choking.
And then you take it. So hold the head like this.
Yep. Yay.
And then turn over and then do the compressions.
Yep. A little bit higher, like right up in here is where you do chest. Yep. Perfect.
Right above the line.
Yep. Kind of in between the nipples on an infant, because they're right here, right in the center of the chest.
One more hit.
There you go. Okay.
Oh, my baby's choking.
Yeah. So lay it across. Yep. Perfect. Sometimes they don't, so don't worry about it. Oh, you got yours. That's good.
God, I saved her.
Do you want to do one that might work? No, just kidding.
Here, you can use this one.
Oh, that's it. Yep. And you could be aggressive with the palm of your hand.
Back first.
Back first. Yep.
But if you're aggressive, you gotta have pretty good.
Yeah, you gotta hold their head.
You're gonna, yeah.
That's perfect. I shouldn't tell you. I should tell you a story, but
I'm sorry.
I had my granddaughter was over, and she was 3 months old, and she was she was sucking on a big dill pickle, right? And I was like, oh, she liked the taste. She went like this, broke off the pickle. She's only 3 months old, and I'm like, so I picked her up and I flipped her. Like, oh my God. Yeah, she was fine, but it scared me I'm like, oh my gosh, she just had a big pickle in her mouth. Oh. Okay. Very good. So you guys know where to put if you're going to do compressions, it's like right in the middle here. Yep.
But 30 of them you said, right?
30. Well, you keep.
Unless when they're choking on them.
Well, no, you would do 30 and 2 breaths if you want to.
Okay.
But you don't have to do breaths. You can just do CPR too, that's okay. But if you want to do breaths, it's 30 and then 2 breaths, 1 over each second. You just go and then breathe.
Okay.
All right. Good.
Hey, Sherry, you cheated. You don't get a chance to play with the baby.
I'm LGMS certified.
So if anybody wants help with the Pulse Point app afterwards or anything else, I can help you with that, too. I'm going to go through a couple other things that are emergency related, if that's okay. If someone has to go, that's fine too. But I was going to touch, give me one. Okay, so allergic reactions are a medical emergency. Like if someone or you're with is having a severe allergic reaction, and sometimes they can't breathe. I mean, sometimes people die from allergic reactions too, severe anaphylactic. So especially, there's so many allergies out there. We're seeing more of these. Someone's face starts swelling up, or their throat, and they're starting to itch. Then it's time to use an EpiPen. If they have their own EpiPen, you can help them use it. Because a lot of people that have had allergic reaction before have an EpiPen prescription and have it with them. Sometimes they are unable to use it though because they're having distress. So I'm going to show you how to use it. It's really easy, actually. So this is a trainer, so it doesn't have medicine in it. Okay. So you actually take the safety cap off, and it goes in your thigh, and you hold it for 10 seconds. So what you do is you kind of you have to do it a little bit forceful, but you just go into their muscle right here. You can do it through jeans, pants, not through snow pants probably, and then you just hold it on their leg for 10 seconds, and then you would actually massage it in. If someone has an allergic reaction, they always need to go to the ER though, because this lasts 30 minutes and they need to get the longer acting medicine. So it's always a medical emergency if you use an EpiPen on someone. They should go in. Even if they start feeling better, they should still go in because that's a bad reaction and they need to have some medicine that you guys can try it on yourselves or each other, whatever you want to do. Yeah, cool. It's easy to use, but that's good. He's got one. Trust me, I've had plenty of people come to the emergency room with allergic reactions too. And I'm going to show you one more thing because this is another emergency thing we've been trying to get out. And one of the reasons is they determined after like some of these mass shootings, not that it can be used in many other instances. When we use it is from like somebody cut themselves with a knife or they're out hunting, whatever. They cut themselves deep and they cut an artery. You can actually lose all of your blood. And there were many people that died in the Las Vegas shooting because EMS was unable to get to the people. So a lot of people lost too much blood and died. But if bystanders or even themselves knew how to stop the bleed, this is called stop the bleed, that lives could be saved as well. So anybody that goes hunting or fishing or does outdoor activities, I would suggest getting a less than $10 tourniquet off of Amazon. I got one for all my kids and their kids' friends when they hunt because they are all hunters, because a tourniquet can save your life. If it's a small wound, this is my my simulated wounds because they're $900 a kit. But this is a pool noodle, some flesh-colored duct tape, and a bone in here. So I use it, but it still works. So if you have a small wound, you can see it, you can just put pressure. And don't peek. You want to just hold pressure if it's bleeding out. Sometimes it'll squirt. So the more pressure you can hold, the better, and keep pressing. Okay, because that's what'll stop the bleed, really. And however, like say you have a big gash, as deep. If you push up here, it's not going to make much of a difference, right? Because you're not pushing the vessels down here. So what we say is pack it up. You can use anything. These are just gauze that we have that we pack with. So you would pack it until it's full, until you can get it in there. And then when you hold pressure on it, you're going to compress the vessels. So if you have a big wound somewhere, you can use a shirt. If you're out and there's bleeding, whatever, use what you have and stick in that wound. Not something super dirty, I suppose, but saving a life is more important, So you push really hard. Don't let it up. If that still doesn't work, tourniquet is what we put on. And so a tourniquet is super easy to use. It just comes rolled up like this. It just slips on a joint, on an arm. So to say this is the arm. One of the important things on a tourniquet, if you're putting on a tourniquet, can't be on a bend. So it's if you're bleeding from here to here, you know, on the limbs, not if you have like an abdominal wound or up here, you're going to have to pressure. That's it. You can't put a tourniquet on. But if it's on your limbs and you're bleeding, which most of them actually are, it seems like, then you could put a tourniquet. It has to be like 2 inches above the cut, and it can't be in an elbow. It can't be like in the joint itself. It has to be below the joint. So one of the important things is you have to get it as tight as you can when you put it on. So you want to put it as tight as you can, and then you got it on. You also want to tell the person it's going to hurt, but it's going to save their life, you know, if they're bleeding out. So these do hurt. And then you turn this. This is called a windlass. You turn it until the bleeding stops, and then you could Velcro it in here, and that's it. I only have one tourniquet but anybody can try it if they want. We'll just pass it around. You can use, if you have an ACE wrap, you can wrap, you know, around the pressure to hold pressure on it too. If you're getting tired, especially or whatever, wrapping really tight. That's how we put pressure dressings on, is with a wrap. So you want to pass? Okay. I should have brought more, but anybody who wants to try a tourniquet. So yeah, it's important to have those in your toolbox. You know, if you have anybody that's farming or hunting or fishing or anything like that, having a tourniquet is important. I'll tell you what, I put on tourniquets, and you actually really have to I had to turn that quite a few times to get the bleeding stopped. It takes a lot of muscle, actually. Sometimes it depends on where the vessel is, but yeah. We just had someone come in today. But I didn't need a tourniquet. We just held pressure, but bleeding quite a bit from a machete. So don't play with machetes. It's bad.
Yeah, an ice skate going in my leg when I was a kid.
Did you really?
It cut the artery.
Yeah.
So I've got a nice scar right above my knee there, where it's the size of an ice skating blade. And the doctor said, I can't believe in normal circumstances you wouldn't have lived. But if I hold my leg stiff, the bleeding would stop. But as soon as I go,
Yes. It's.
all the fat come all around, and I was a skinny kid.
You're like, what?
I did.
She did it. All right. That's good. I really appreciate you guys coming tonight. I know I went pretty fast, but yes.
Oh, you can finish and I'll ask the question.
You're always welcome to. On our website, we offer quarterly CPR and first aid classes. So if you're ever interested in getting certified, we have classes available. And just keep look on our website, because we'll post when they are. And I usually put them through the Chamber of Commerce too, our classes that are available. But you don't have to be certified to do CPR and NAED. You don't have to be. Oh, it's Mercy Hospital, Valley City. Yep.
You know when the next one is?
I don't. Okay, that's me. I have to set one up in February here. But if you leave me your name and number, I will call you and tell you when it is. Yes. So that'll be good. I brought something. That's probably the end of presentation.